High blood pressure is the #1 cause of kidney damage and can lead to kidney cancer. Hi friends, in this video, I want to talk about the 6 most common symptoms of kidney damage, what tests to request when you're at the doctor's office, and what you can do to keep your kidneys healthy. So #1 is urinary frequency. If you find yourself going to the bathroom more frequently or less frequently, then something's probably happening in your urinary tract. When your kidney is stressed, you will notice that change in how often you urinate. It could be getting up in the middle of the night. It could be getting up more often during the day, or it could be the opposite. And the key is that when it's a new symptom, you should monitor it, and if it persists, you should talk to your medical doctor. And this can happen rapidly in just a day. Your urine is really a product of how well your kidneys regulate your body's fluid, as well as electrolytes, essential minerals, to regulate your health. It also filters toxins. And so certain medications can affect how much you urinate. So if you're on medications like a diuretic called Lasix for heart failure or thiazide diuretics for blood pressure control, just know that you're going to urinate more often, and that's very normal. But with that loss of urine comes a loss of electrolytes like potassium, magnesium, and you'll likely need those repleted. A change in your urine also can be observed in the color of your urine. So that means you need to look in the toilet and look for how your color is right now so you have a baseline. It should be a light yellow if you're well hydrated, but your shade of yellow will change depending on how much fluid balance you have or imbalance. It'll be darker when you're more concentrated, like first morning urine, because you haven't been drinking at night. And if you get dehydrated, it will concentrate to that color again. If you have also excess bilirubin, that will also be in the urine. That makes it very dark brown. That could be a sign of liver disease, gallbladder disease, or a viral infection. And you'll see, an abnormal shade of brown as opposed to yellow. Now, if you're anemic, your urine may also be brown, especially if you're peeing out red blood cells. They could be destroyed inside of your kidneys, or they can be caused by a stone. All of this is not normal and requires a medical workup. When you see bright pink or red like cranberry juice, you're bleeding somewhere in your urinary tract. This is called hematuria. This may not be a problem with the kidneys at all, but it still is your urinary tract, and it can start at your kidneys. So oftentimes when it is a kidney issue, you actually won't be able to see the red blood cells with the naked eye. But if you do, make sure you get that checked out. Sometimes other medications and foods or vitamins can also pigment your urine and make it a different color, because your kidneys are actually secreting these chemicals, which can be very natural chemicals, and it's a very natural thing for it to do. These water-soluble vitamins like vitamin B2 or riboflavin, it can make your urine kind of a highlighter yellow. If you're eating beets or rhubarb, your urine may turn a shade of red. This is all very normal. Medicines such as phenylxyropyridine can turn your urine red, and rifampin turns it orange. But if you're ever concerned, see your medical doctor. Sometimes you will see your urine foamy. That means there's a lot of protein in the urine. That's actually not good. And this is why, when you beat an egg, like egg white, it gets foamy. You shouldn't be losing protein in the urine. There's inflammation somewhere in your kidney or in your urinary tract. When you lose protein, you'll swell up, because protein is actually what keeps the fluid inside your blood vessels. So when you lose protein, you start leaking fluid into your tissues. And if your kidneys don't balance your water, there's no way to remove the water you drink or make from normal metabolism. So sweating, breathing, and pooping, they usually won't remove enough water unless you're having profound diarrhea. Now, you can gain a ton of water weight in a few days. And if you notice your feet, your ankles, or your legs swell up, this is called edema. If you press on it for 5 or 15 seconds and it leaves and depression afterwards, you are having pitting edema. Now, this can be very dangerous because the same thing can be happening in your lungs and cause you to be short of breath. Another sign would be to have puffy eyes. Some people may not notice the swelling that's happening in your legs because you're overweight, but your face, especially around your eyes, it gets puffy quite easily, and a change in weight is more evident. The fluid collects around your eyes since there's not a lot of tissue there. Another symptom of kidney problems is fatigue. Really, all these changes cause you to be unable to filter toxins, and that's why you're tired, weak, and fatigued. All these are inflammatory symptoms that need to be worked up and addressed and reversed before your kidneys are permanently damaged. So when you see a doctor to work up your concerns, here's what you should expect at the very first visit. They should take your blood pressure. Ideally, you should already be doing this on your own by buying an inexpensive blood pressure meter, which may be covered by your insurance. And it's important to have a normal blood pressure daily. A value under 120/80 is normal, or at least below 140 and 90. High blood pressure is the #1 cause of kidney damage and can lead to kidney cancer. But you can't just get there if you're really high. You'll have side effects, so work with your doctor to get to a normal blood pressure. The doctor should also check your urine. Make sure it's always a clean catch. That means you clean your privates, they give you a little towelette, and then you pee a little bit and you catch midstream. And it has to be a sterile cup. Oftentimes, infections can cause changes in the urine and cause you to leak white blood cells or red blood cells, or give you positive leukocyte esterase. All these things can be caused by bacteria, especially when you have nitrites, because your urine has nitrates and bacteria can convert it into nitrites. So you have a ton of different bacteria. Many of them are harmless, but it's important to know what's inside, and this is why a clean catch is super important. So if you remind them to reflex the abnormal urine analysis of culture, your provider will probably be impressed with your knowledge. Your urine can also be checked for hydration, how acidic your urine is, and if you're peeing out protein, sugar, ketones, blood and bilirubin. You're going to also need a blood test to check for basic electrolytes and blood urea nitrogen and creatinine. You may also need your electrolytes replaced or removed when your kidneys are damaged. It's hard to tell which way it's going. From these simple screening numbers, they can estimate your glomerular filtration rate, which is an important number to help us estimate how well your kidneys are filtering. We want your GFR to be above 100. Under 90 is a problem, and under 60 needs to be monitored quarterly. And if you're under 30, you're going to need dialysis in the near future. So whether you're trying to prevent kidney disease or want to improve kidney disease, here's what you can do. #1 is to reduce your vascular inflammation. And the best way to do that is to get your blood pressure normal and to get your blood sugar normal through food and nutrition, as well as exercise. And this will help you get to a normal, healthy weight. Exercise daily for at least 10 minutes 3 times a day is a super helpful way to start. It's also important to remove toxins, and these toxins include sodium, and I explained in other videos why sodium is hard on your kidneys. And sodium is found in processed foods like pizza, snacks, deli meats. Painkillers are notorious for being kidney killers like NSAIDs. Excessive dietary protein is also harmful, and this is even more prevalent if your kidneys are already damaged. Smoking, whether it's tobacco, cannabis, or inhaling cooking fumes or forest fires, are all toxic to the kidney. And drinking any type of alcohol is worse for your health than using it to kill germs. Alcohol clearly causes liver damage. And oftentimes, liver failure leads to kidney failure. So if you want to learn about symptoms of liver failure, watch this next video.